So our next speaker is Dr. Mohan RAJAN. He's going to present the magic of cotton bud.
I have some water before that.
Hey, don't tell me. There is positive water and conference.
They've given us this. They're supposed to fill and
So it's okay?
1 minute. Before that, I would like to compliment Vinod. Let's give a big round of applause to Vinod for this wonderful session. I've been participating for more than 5-6 years. I won 3 times. Last year also, I gave it to the younger fellow.
Now you are emeritus.
Yeah, no problem. But I just want to, because I'm participating, just to give you one simple message. That's the idea of this 2-minute tip, 2-minute video. One simple message which you can do it tomorrow. So let's start the video now. So this is, when you're doing FACO, when you're having a PCR, when you withdraw, what is happening? There is a forward movement of the PC and the opening of the PC. If you have a toric lens, when you withdraw, see what's happening. The toric lens rotates, okay, from the axis, from the intended axis. Again, when you have a patient with IFIS, you can see how the iris is coming out. Okay, all these problems can occur when you withdraw the instrument from the eye. You can see how the PC is moving forward and chamber is becoming very shallow. So these are all the problems which you see. You can see again a patient. I can see here how the pupil is becoming small, and once you withdraw abruptly the instrument, either the phaco handpiece or the IA handpiece from the eye. So what I have devised is a very simple thing which you can do this. Okay, this is called the cotton bud, the magic of the cotton bud. You can see how this patient has got IFIS, the iris is coming out when you withdraw. You just take the cotton bud, okay? See what I'm doing now. When you come out of the eye, just press that, okay? Very simple, okay? Everybody can do it. Even press, you see, there is not a micron of movement of the PC. The pupil stays still, and then you can go ahead with the rest of your procedure. And this patient again has got IFIS. You can see here the previous one. You can see this patient, the iris is not coming out at all because you are holding that. Again, a patient with a toric lens, the lens does not tilt at all because you are holding that lens, the incision very tight. This is a magic of the cotton bud. I'm sure everybody will be able to do it without any problem, and you can do it on a routine basis. For all patients, you can do this to prevent the posterior capsule coming forward, the iris from coming out, or the lens from rotating. Thank you very much.
Mohan, this is a wonderful video. The idea is absolutely amazing.
Yeah.
The only negative thing about the whole thing is that you're using a cotton bud, which is a vegetable material. So you devise a metallic system to press the wound and not the cotton. That is my suggestion. Besides that, everything is wonderful.
No, are you not using cotton buds at all?
I am not. No.
How many of you are not using cotton buds?
We are using.
Everybody is using.
And
but they
for
should
him,
not.
name it Vexile sponge.
The idea is...
The problem is sponge you cannot press, madam.
Sorry.
That's a problem.
The idea is not to promote something which is not
I know,
advisable.
I got your point, but I'm asking.
If 100% of the people are using formalin in the OT, it is a carcinogenic agent and should not be used. So that doesn't deter Indians from not using it, unfortunately. But that's
No,
that should not be the
reason
protocol.
why I
Let us
asked.
not argue on that.
No, I'm not arguing. Please, the reason why I asked, because I thought everybody is using cotton buds.
We are using.
That's all.
Sir, it's a good suggestion, but because now we are using 2.2 millimeter of incidence, clear corneal incidence, so now the things has become quite simple, because even if we withdraw suddenly, the chances of sudden collapse are quite less. But obviously, it's a suggestion is always good, because even with the polar cataracts and other things, we are doing the same things. We are keeping second hand ready with viscoelastics, we fill it.
His eyes are very good, especially low resource settings when you don't really have too much of stuff with you. So Coton bud is good. And even 2.8 Pro one can easily use. 2.2 needs a little better phaco system also. The lower end phaco systems don't come with the 2.2. So yours is really good thing. I think it's a very helpful.
No, I think whether it's 2.8 or 2.2, when you come out of the eye, there is going to be a forward movement. Please understand.
There is.
Doesn't matter whether the size of the incision. So what I'm trying to do is just keep the cotton bud, seal that incision before you come out. That's all.
It's a good tip.
Very good concept, sir. Yeah.
Thank you.
But you can always put in viscoelastic from the side port or fluid also at the end of the surgery. You can use
Viscoelastic,
UCC
you
syringe.
require an assistant to put it sometimes.
No,
It is
with
a
the
little more
left hand
cumbersome.
Left hand.
So that's why I'm telling you. This is a very simple tip, straightforward.
I think cotton bud helps sealing in the incision.
You don't have to stop the irrigation. If you want, you can stop the irrigation. Yes.
Hydrating the wound, just press it with the any sort of even the marocell or the cotton bud. It basically serves the purpose. Even when you close it, when you finalize your surgery.
I think
It's a
it's
good
a very simple, very easy to use
Yes.
and very practical tip. Thank you so much.
Thank you very much.
Thank you, sir.